The British Society for Antimicrobial Chemotherapy, or B-SAC, is dedicated to improving the prevention and treatment of infectious diseases through education, research and collaboration. We spoke with Professor Andrew Seaton, President of B-SAC, about antimicrobial stewardship and the urgent need for global action on AMR.
Tell us, what does B-SAC do?
Well, the British Society for Antimicrobial Chemotherapy is a global charity. It's been going for more than 50 years now, and it's really focused on antimicrobial use, from the development to finding solutions for antimicrobial resistance to education, policy and advocacy. We've got thousands of members. Membership is free, and we've got members all around the world.
How great is the threat of drug-resistant infections?
Well, it's a real and present danger, and there are some health systems in the world that are really badly affected by it, and particularly in the global south and low-income countries where they've got relatively limited resources. This is a real problem in some of our critical care units. In the global north, in the United States, the UK and Europe, this is a real everyday event. But for most people going to their general practitioners, it's not necessarily an issue today. But that's what we're really worried about, that this will become an everyday problem. In fact, if we go back to 2006, 2008, when we used to see lots and lots of MRSA infections, that's gone away because of some of the stewardship initiatives that we brought in at that time, using the antibiotics or pulling back on those antibiotics that drive those particular infections. So I think it's not in everybody's consciousness at the moment, so it's a bit of a silent pandemic, but it's definitely going on today. It's going to get worse, and we need to take action against it.
What more can be done to ensure we're taking care of antibiotics?
The first thing is making sure that the right patient gets the right drug at the right time for the right reason, and also for the right amount of time. That's really important. But critically, it's also about making sure that we don't give antibiotics or antimicrobials to those who don't need it. In hospitals, it's a big issue, and the Society, B-SAC, has developed the Global Antimicrobial Stewardship Accreditation Scheme. And this scheme, which is truly global, looks at helping and supporting hospitals anywhere in the world to build up their own infrastructure, their measurement, their intervention, their guidelines, and their education, which supports better antimicrobial stewardship in that setting.
Why hospitals?
I think the expertise in how we use antimicrobials, how we deploy them, how we, in a sense, restrict them or protect them, comes from people, infection specialists who generally work and live every day in the hospitals and deal with these issues. But you are absolutely right. Most antibiotics and antimicrobials are prescribed in the community or dispensed in the community. And as a society, B-SAC, we're looking really closely at interventions and initiatives that can help support prescribing. And over the next 1, 2, 3 years, this is going to be a really important focus for us in B-SAC, is about training, education and supporting prescribing and antimicrobial stewardship in this kind of wider population.
And looking at the bigger picture, what does global action on AMR look like?
Global action is about mobilizing politicians, policymakers and financiers to make sure that we have the right political will, the right advocacy and the right funding streams to support all the initiatives we know that could make a difference. We have the tools. We know what the educational elements are that are required. We have this kind of support network building around the world to do these things. But what we need is the impetus of the governments of the world and the leaders of the world to say, yes, this is a problem, and yes, we really need to commit to this and to make antimicrobial resistance a thing of the past.
Professor Andrew Seaton, thank you very much.
Thank you.